Welcome everyone to today's Cuppa Club. I'm joined today by Andrew Payton from the UK National Asbestos Register Community Interest Company, or UKNAR for short. Hi Andrew.
Hi, nice to be here. Thank you very much.
No worries. Do you prefer Andrew or AP?
I don't mind. I think Andrew is slightly less confusing for most people.
Okay, right. In that case, well, yeah, good to bring you on to the Cuppa Club today, Andrew. For those who don't know me, I'm Josh Brewer. I'm the Senior Business Development Manager at Ethex. Andrew here is the CEO and founder of UKNAR. Got lots of experience in the health and safety sector. And UKNAR was set up to sort of help key stakeholders manage asbestos simply and safely. And also it's about informing and educating people who might be at risk. So just before we get into the main body of our conversation, just a little bit of housekeeping. So the aim of this session is to learn more about what UKNAR does, you know, what your vision for the organisation is, what your mission is, why what you're doing is really important. It's important to say this isn't a financial promotion, and we can't answer any questions about individual circumstances. If anybody's got questions, so we've got the chat function here. If you just drop them into the chat, I'll try and work them into the conversation, or if I can't get into the conversation, I'll just pick them up at the end. If there isn't time to answer all the questions, we'll do follow-ups on those. Just so everyone knows, we are recording this session. We're going to upload it to our YouTube channel and website, so you can watch it again or share it. And it should be about 45 minutes or so. Okay, let's get started. So, I think when you think about asbestos, I think pretty much everyone is aware that it's dangerous and that there's still quite a lot of it in buildings. But I guess I certainly had the impression that it was under control. And so why did you think it was important to set up a National Asbestos Register?
Well, to be honest, despite being in the world of health and safety, and primarily has to be said, fire safety, I think I probably thought the same. And I think that's the interesting thing, is that I think most people think it's dangerous, but it's sort of all under control. And a lot of work has been done, but there is an awful lot of asbestos out there. And really, it came from a conversation with Andy Brown, my co-founder, with the understanding all of a sudden, that moment of realization that although a lot of it is better under control, so when you have a major refurbishment, it's really managed very tightly, mostly. The fact is that I suddenly realized from that conversation is that there's lots and lots of people going into buildings every day and they're disturbing it. And then it is no longer under control, because asbestos is mostly safe until you disturb it, releases the fibers. And suddenly did a little bit of maths, and we worked out that there must be thousands and tens of thousands of people actually being exposed on a daily, well, on an annual basis for sure. And that started me looking further and further into it. And as I looked further and further, thought, that's not kind of how you would want things to be. And it was a complete shock to me to begin to understand the scale of the issues. And to a certain extent, and I'm in dangerous territory to say, the reluctance of people to admit the scale of the problem that is actually still out there.
Okay.
Go into the press and suddenly you see an awful lot more stuff. If you look under asbestos in schools, suddenly you start seeing an awful lot of stuff.
Well, I think that's one of the interesting things, you know, looking through the information in your offer document, is that, given the fact that such a lot of control systems had been brought in from the 2000s onwards, that there'd be an expectation that fatalities related to asbestos exposure would have started to decline by now. But my understanding is that hasn't actually happened.
No, it hasn't happened. It will happen, but they keep getting it wrong by about 10 years every time. So there is more of an ongoing problem than they realized. And yes, some of the measures taken, it won't stay at this level forever. But unfortunately, there are a lot of degrading public buildings out there. As we've seen, Grenfell Tower is a good example of this. And with that degradation, the risk increases rather than decreases. So, and like Grenfell, it's all about, it's really hard to get the right information to the people who are most at risk when they need it on site. That is the key moment. And it's all very well having legislation and rules and everything else, but the poor duty holders, and they are the poor duty holders quite often, struggle to do their job properly in that particular respect. It's a genuine challenge for them.
Yeah, that's right. And I suppose that, that then, given that it's still a prevalent issue, that I suppose makes sense to kind of collect information on where that risk lies. And I guess that's the thinking behind setting up the National Asbestos Register itself. I guess one of the questions is, it seems a bit of an obvious thing to do. Why wasn't that done before?
Well, you're right at one level. I mean, first of all, the information, or at least 90% of it, actually does exist, but not in any central place. It's often in dusty files that may or may be locked away, and people may or may not know where it actually is. But the good news is the information is actually there. Why hasn't it been done before? Quite a few answers to that. It has in certain countries. So Britain is behind certain countries that have actually built a national asbestos database. So, and we have the highest rate of mesothelioma in the world and the highest use of asbestos in Europe. So arguably something should have been done. But I think the thing that is important is when the HSE sort of last looked at that, and when people have tried it before, the technology just wasn't there to make it easy or useful. Everything has changed. You have 3G, 4G, God knows 5G. Data is now cheap. You can build systems for a fraction of the cost before. And of course, you've got this amazing thing here, this thing, which has really come to dominate our lives in the last 4 years. So really, it's about technology and timing. It's a timing issue as much as anything else. Yeah.
Okay. And so could you just talk to me a little bit more about UKNAR as an organisation? So what's, what sort of form of organisation are you, and what's your kind of mission or vision as an organisation?
Yeah, well, we put quite a lot of thought into that, because once one begins to understand the scale of the issue out there and the number of people and types of people that one has to actually work with, which are associations, charitable campaigning organizations, local government, central government, etc. You've got to be credible to deal with these people and relatively speaking neutral in the scheme of things. And so that's why we went for a social enterprise. But we also wanted to be able to trade, because we want people who are responsible, the duty holders, to pay for it. So we wanted to be able to trade, and we wanted to be able to raise finance too, rather than be a charity relying on donations. So it's all of those things that then we went for a community interest company. And the thing about a community interest company, because anyone can sort of call themselves a social enterprise, is that, for those of you that don't know, is that if I've got this wrong, is there's an asset lock. So first of all, the shareholders can never make any money as shareholders in terms of capital gains. That doesn't exist. The profit is for the purpose to serve a public aim, which is stated in our articles, which is to protect public health through prevention of avoidable asbestos exposures. And I believe that at least 2/3 of the profits of that business as an enterprise have to be reinvested in there. In reality, we'll be investing 100%, and our priority is to deliver on the mission. And the mission is to really, I can see obstacles, but no reason why everybody shouldn't know whether there's asbestos in their workplace or not, quite frankly. And everybody should have access to it, or who needs to, and there's an interesting conversation about that, should have easy access to that information in a way they can understand. Because how can you ask people not to disturb asbestos and they're not shown where it is?
Yeah,
that's it, really.
Yeah, and that leads quite nicely into thinking about the impact that you deliver as an organisation, because I mean there's obviously there's a public health and safety issue here, but I think maybe something that isn't appreciated is that where the risks lie, they tend to lie for people from from lower income backgrounds often. So if you
Yeah.
Is that the case, or is that?
No, it is very much the case, and I'm at risk politically here, but it's, to be honest, it's often the case that the people who make the decisions are not the people who have to deal with the consequences. And I go back to Grenfell as an example of that. It's the people who pay the consequences when it goes wrong are the people on the ground. The most at risk are the tradespeople and the IT workers and the plumbers and the electricians who come up to buildings. They're not given the information, they're expected to do the job. And a lot of them work blind and they're playing sort of slow motion Russian roulette. They may or may not disturb the asbestos. That is terrible. They are the people, probably 90 times the risk of the general public. But then you start looking a bit further and you realize that public buildings, we built a lot of buildings in the 1960s and 70s, schools and hospitals, coming from, ironically, with an awful lot of asbestos in there from a fire to protect people from dying from fire. Those buildings have their issues, and some of them are degrading. And actually, that asbestos needs to be managed really well in those buildings, and it's not that easy to do. And so suddenly, not suddenly, unfortunately, very, very gradually, we've worked out that teachers are 3 to 5 times the risk of the general public, and there's probably several thousand, between 5 and 10,000 pupils, former pupils, have died just because of exposure to asbestos in their school environment many years later. Now, that's hard to work through. It's taken a lot of statistical analysis by somebody called Professor Peter, who's an epidemiologist, because the occupation is, when you die, is normally, is the only thing that's recorded. So it just shows you that, again, it is like a lot of other, there's a health inequality here, and it's not the people mostly sitting in the offices.
Okay, thank you. So I'm just going to, a couple of sort of maybe slightly more technical questions have come in about the different types of asbestos. So there's a question here saying that, the white asbestos, which I think is used in a lot of things like Artex ceilings, for example, being much less dangerous to human health than the brown or blue asbestos. Mm-hmm. And so I guess it's just, do we need to talk about different types of asbestos? Do we need to talk about different types of, risk related to asbestos in buildings? I
think you do. It's a little controversial because you may find some unions sort of saying all asbestos is dangerous and equally dangerous. And there is evidence that says, no, not all asbestos is equally dangerous. The gist of it is the fibrous quality of the asbestos and the nature of the fibers, and whether they stick into your body, and certain types of fibers are more likely to stick there and cause you mesothelioma, which is the deadly cancer 15, 40 years later. So it's really mostly to do with that. But a good example of this, again, is schools. So you can have asbestos fibers bound up in some vinyl floor tiles. Well, until you start grinding it with a sand grinder and inhaling it, it's not really much of a risk. On the other hand, if you have asbestos in what they call AIB, an insulating board, and it's in a classroom in a ceiling, and someone changes the light bulb and puts a smoke detector in, that's a lot more dangerous because it's releasing fibers. So, and that's part of the reason why you'd want to have a national asbestos database. So you're not looking at everything as a priority, because it would cost 50, 100 billion pounds to remove all the asbestos. So it'd be helpful to prioritize it.
Yeah, great, thank you. And then just, I suppose it would be useful to talk a little bit more about your solution. And so what is it, how is it that you are helping people to manage this risk? What is it that you've developed? Obviously, you've got the data, but then how do people access that data? How is that useful to a contractor coming onto a site?
Yeah, well, I mean, we don't have the data. The people who have the data are the duty holders and some of the big software providers. So they have the data. It is actually their responsibility to get that information to anyone who might be at risk of disturbing asbestos, anyone, but especially the visiting contractors. And I will go back and say, when they've got a big project, nice refurbishment project, sure, everyone's organized, that'll happen. But when you just got people going around changing a smoke detector, a light bulb, plumbing, etc., then they may struggle to get it there. Sometimes it works. So sometimes the file in the reception will work, and the reception knows where it is, can tell you where it is, and even understands which pages to look at. The problem that exists is that that often isn't the case. They either don't have the information to hand, or the poor person is turning up with the tools, or they don't have it in a way. This is the thing that we've found quite so shocking, is that actually what's presented to them is often a 100-page document they can't understand. In fact, it takes a professional to understand. So what we're doing is making it easy for the responsible employer and duty holder to get that information to them. And the way that we do it is we take their asbestos registers, or we may take their asbestos management survey, get the asbestos register out of it into a mobile-friendly format, and put it into a QR code so that it's now so that connects with the building into a notice. So it's probably easier if we can just show a notice, because it really is dead simple. I don't know if we've got a notice to hand, maybe.
I think, yes, Julie, if you could just do a share on that and show the notice. Here we go.
So I seem to have got lost on that, but that's good. I can't see. So all you do is the notice is very straightforward. Sorry, I've actually lost sight of this just for a moment, so bear with me.
Has it come up on your screen? So,
no, not on mine.
Okay. I mean, I can basically describe it to anyone. It's just a quite a straightforward poster on there that tells people about the need to be asbestos.
Oh, yeah, I've got it back. Sorry, guys. Yes.
Okay.
Yeah.
You take over.
Sure. Thank you. Sorry about that technical hitch. Yeah, it's a straightforward notice. It doesn't have to be exactly like this. But the important thing is that it's there in the building, preferably in reception with a receptionist as well. But it's not always possible the receptionist is there. It needs to be integrated into contractors signing in procedures or contractors visiting procedures. And really, all you do is you take you get your camera out, you scan. The nice thing is we don't have to explain that anymore. And if you were to scan that with your camera, so please do, what you will see is not a 100-page document with the lots and lots of stuff. You'll see the 5-6 pages that are just relevant. So they're not hanging around, waiting, looking for, reading, scrolling through documents. It's there for the emergency services. It's there 24/7. So we've taken that information and made it accessible to people when they need it. There's no charge to them. The duty holders pay a small license fee per year for the service. It saves them a lot of time and money, even without an accident. Just the admin of getting this information to people saves them. And it makes it just dead straightforward. There's more stuff behind it. There's stuff like usage reports that help duty holders understand that the job is being done properly, because they often don't really know if someone's actually looking at the information or not. That's very useful. And there's a little QR code, which I very much doubt will work, but I'll try it myself. Put your phone against that. I doubt in the corner. It won't work on this one. We can.
Yeah, I mean,
it won't work on this one, which is fine. But that little QR code there, we did this for schools, interesting enough. If that notice is put in other places, like a teacher's staff room, there is an obligation for teachers to know a bit about asbestos and to know where it is. And if they scan that, there's a 1 minute, 50-second sort of video that just explains what it is they need to know, and then they have access to knowing where the asbestos is. Because teachers, interesting enough, are unlike office workers. They are also people quite capable of going around and poking in places where perhaps it's not always safe to do. So it's really, really simple. There's other stuff, but in its basic format, it's getting brief, concise information that people can understand when and where they need it, 24/7. That's it, really.
And what we'll do is that after the webinar, we'll send out a follow-up mail, and we'll embed a link to this document so people can have a little play with that and in their own time if they want. Julie, if you could just stop sharing that now, that'd be great. Okay, thank you very much. So we're back. So I guess, I mean, you sort of touched on it there and talking about the fact that the duty holders pay a license fee. Would you just like to talk a little bit more about, the business model that UKNAR has, and I guess what are going to be your sort of drivers for growth? And you are doing a fundraise on Ethex at the moment. How are you going to be using that money in order to develop the business?
Yeah. Yes, the business model is a very straightforward business model. It relies on an annual license fee, a small amount. It does depend. If somebody's got huge numbers of buildings, it can be below £100 per year. The average seems to be about 200. Some larger buildings can be more. So it's a license fee that the duty holder who's responsible for managing asbestos safely in that property pays. And it's peanuts compared with the cost of running buildings, anybody knows. So that is the key part of it. We have an upfront mobilization charge, so that if somebody's got something really complicated, we don't get stung by spending 2 weeks trying to work out their documents for them. So we can charge by the hour. That's to safeguard ourselves. But it's a very simple model, and once we've got it up and running, then until they remove the asbestos safely, they'll be paying that charge. Now, we hope eventually that all asbestos will be removed, but unfortunately, we know it's going to be tens of years. So that's the gist of it. Now, not all buildings, all estates with asbestos have the same issues to the same degree. So what we did last year was we looked hard at where the greatest risks are and where the greatest challenges for management were, and where people would be most interested in joining us, really, I think. So, for example, we discovered that universities, although they have got quite a lot of asbestos, they manage it really well. They've got whole asbestos management teams, and they spend millions on systems. Schools, more of a problem. They don't. And we also discovered multi-academy trusts who are now responsible for lots of schools, lots of registers from all sorts of people, really have some challenges there. So our research has shown that actually they are really, really interested. And I think I put in the report that in the document, I think we had about 15 multi-academy trusts interested about a month ago. We've doubled that to actually more than double that already with the new term, because they get it. They understand the issues. So we identify that segment. We know that we have two of the country's top managing agents, Savills and Knight Frank, who are promised, we'll wait and see how fast they manage it, but they've promised to roll us out across their clients. And they're professional property management companies, and they're high profile. So they manage asbestos better already than schools, for example. But they understand the benefit that it's actually helping them do their job better. And they like the corporate social responsibility part of it too. So we've got those two segments. They are the places that we're going to focus on initially, and that's what a large part of the investment is for. So that we're focusing on those. But the second part, the second part of the investment, you could say the more important part at one level, is the fact that although we have a system, it's a prototype system and it's very manual, and we need to make that into a scalable, efficient system. So we can run 2,000-3,000 properties from there, but we want it to hold hundreds of thousands. And the other part about that systems investment is that in the end, we want a nice seamless process working with the asbestos consultancies and their systems and the software systems. And that's what it will allow us to do. And that will allow us to operate on a much bigger scale. So we're talking housing associations at the moment, and they may have 1,000 or 2,000 properties. Well, we need to be doing this with their systems. So that's just an example. And then the last bit is making sure we've got the staff operationally to keep running the customer service.
Okay. And have you got clients at the moment?
Yes, absolutely. Yes. Yeah. We don't have many. We're only in about 300 properties. So that's really not that many, given that we really are, our goal, really, I know there's 500,000 workplaces, but I'd say to have achieved our aim, probably need to be in about 100,000 in the ultimate aim. But we've got a mix, and that's very important. So we've got the managing agents, the professional property companies, we've got schools, multi-academy trusts. We actually have a FTSE 250 company. And so we know that what we've got works and that they like it. I didn't want to have, I would prefer COVID. I'd like to have had some more earlier, but then I'd have done the fundraising earlier too. I wanted to have enough so that we know that what we're doing is sound. And that has been really, really helpful, despite the pains of COVID, inevitably. Yeah,
great. And just thinking back, so you've identified, you've got your two target sectors here, one which is schools and the other which is the sort of property management businesses. And what's, what sort of revenues do you see being able to generate out of those over the course of the next 5 years or so?
I would be disappointed if we were not generating I'd be very disappointed if we weren't generating between 1 and 2 million revenues simply out of those two segments. But the point is there's a whole load of other segments that we just haven't actually got into because of the limitations and because of COVID. So we've had suddenly a whole load of housing associations are very interested in us in our last webinar. So that's very interesting. We were just about to start with the NHS before the COVID crisis. So they will not be the only two segments. That they just happen to be ones that I'm confident to put resource in, so that we know that we'll get a return on our investment. Great.
And so just talk about revenues. Actually, I noticed that you've got something in your in your setup as a kick where you donate some proportion of your revenues to the Mesothelioma Society. Is that correct?
That's right. Mesothelioma UK are the charity that helps support the 2,700 victims who die of mesothelioma every year, and they support their carers, and they also help get clinical research done. And I'm fortunate enough. Liz Darlison's a brilliant CEO there, and they're an amazing organisation. We're in a charity partnership, so we had to go through quite a lot of stuff there to make sure that we were legit and kosher and everything else. And the arrangement that we've got is that 5% of all of our license fees, because profit share isn't really very useful in this, because we're not trying to make a profit, we're trying to reinvest everything. So they get 5% of all the license fees through. And they really like the money, and that's really good. But I can honestly say that they're more interested in preventing the exposures than the money. And they really appreciate the fact that people who've got mesothelioma, it means a lot that we're doing something to stop it.
Yeah, absolutely. No, and then that's great that you cover, exactly, you're covering sort of end to end. So yes, you have the donations to the mesothelioma organisation that's helping people, support people now living with the condition, but then you're doing the prevention piece that hopefully means that they can do less of that work longer term.
Yeah.
That's great. Okay. And I mean, just thinking about, I guess we've been through quite an interesting time in terms of COVID, and, a lot of the organizations that we work with, it's really impacted them and their businesses and their ability to deliver. I guess has this situation impacted, UKNAR as well?
Yes, I'll be honest. I think it's taken us a year longer to get to where we might have done without it. That's the nature of it, because even though people are interested, they're busy lurching from crisis to crisis on their own operational level, whether the NHS that couldn't speak to us for a year, whether it's the schools as the various waves came in, whether it's professional, probably whoever. But we were really, or the consultancies, but what we were really, really pleased that they still found little bits of time to engage with us. And so that did give us the research that we needed. But there are some plus sides from our perspective. First of all, we don't have to explain QR codes to anybody.
Yeah, that's true.
That's good. People actually get it. And that's actually really important, because actually people are now used to it, which helps adoption, makes it just easier for people to adopt, especially all the tradespeople and all those people at risk. So that is a big thing. The second big win that we've actually got is that we can do these. I wouldn't have done one of these before, and nor would a lot of the other people. So we're now running a couple of webinars, and we'll be up to probably 3-4 a month. Some are targeted, some are general. And we now are able to attract 20, 30, 40 organizations to each one. Now, we could never do that before, and we're getting a very good response rate from there. So actually, it's going to help us a great deal. We've just been invited to do a webinar at the Trust Network, which have got about 1,000 estate managers for schools. And, that this just allows us to reach more people. So that modern technology really, really helps. And I think the last thing, and a very, very important thing, is I think the sense of public health and the sense of digital technology meeting each other, and people are now willing to think about different ways of doing things, which they perhaps wouldn't have done before. I think that really is something, despite the pain of COVID, I think that is something that's really going to play to our favor. I can see it already.
Yeah. Yeah, I mean, I think that's one of the things that you've got, that you're kind of at that intersection with providing, quite a simple, straightforward technological fix that people can easily understand. And then I think there's the it's low cost, really, if you think about the licensing, the cost to the business themselves. So it becomes, a bit of a no-brainer in many ways, doesn't it?
It's the nicest. It's a thing that quite frequently comes back. And I've worked in compliance and fire safety side, and I know that unless you make things simple for people, unless you reach the right pricing point, that was another thing that we had to work out, the right pricing and cost point. I'm very sorry. I don't care what legislation says. What I've noticed is it can take a very long time for people to get around to it unless you've made it easy for them, unless the pricing point is actually there. This is easy, and the pricing point is peanuts. So that's really helpful.
Right. Okay. We just had a question come in, because yes, I haven't mentioned that actually, that you are at the moment with the loan stock offering that you've got on Ethex, you're saying to the first 50 investors that that they can nominate a school to receive a free Asbestos SMART license. Do you want to just talk a little bit more about that?
Yes, the way I actually believe that we will really, really prosper is through people introducing us, and that's what's beginning to happen within the school segment. And we are focusing on the school segment because we honestly believe that is the highest large-scale public risk sector that exists. And it's also quite easy for people to potentially introduce, because everybody knows a school somewhere along the lines. So it's just a way of, I hope, people being engaged, which is nice, because in the end, it isn't technology that is the solution. It is about having lots and lots of people engaged at small level, small efforts. And this is just really, really part of that. And I hope we do get 50 people taking it up. That'd be really nice.
You're not far off. You're into the low 40s last time I looked.
Great.
Your offer's doing well at the moment. Is it just a question come in, and it's just, I guess it's to try and understand a bit more about the rest of the team at UKNAR. So obviously yourself. Would you be able to just talk through who the other sort of key people in the organisation are?
Yes. Well, Andy Brown is the person who actually knows what he's talking about here. Which is important as my co-founder. He's had more than 20 years in the asbestos world, so he understands it inside out, and he also understands IT. I'm afraid I'm like most, I'm not saying all the people here, but I'm not an IT person, which is why I quite like what we're doing, because if I can understand it, then anyone can. And that's his background, and that's very, very important. And his co-founder and our operations director. Candy, and these are people I've worked with for years, because it's very important when you've got an enterprise or something, is that you've got a team that you can trust and work with. So that's really important. Candy March, not only has she worked with me for many years before in a Metro Safety Group, which is the fire safety group I was talking about, her experiences in chairing and coaching, and she's been chair for a number of social enterprises and charities, and that's really important because we need to get this right. It is about, I don't mean it in a lip service way. We have to. This is all about trust and credibility, and we've got to do things right for people, and we've got to work with quite a wide range of stakeholders. And she's got great skills there, and she's helped us with IT projects in the past too, which is kind of also very important. And then Susan Brown, she's running our customer service side of things, and she's had the experience of of working with people in the social sector and where asbestos registers are required. She's also had great credit control experience. It's also very useful in a small startup. But we've also got more people that we'll be bringing in that we know and already there, really subject to the raise going well, which it is. So that will help us. So that's really rather good news.
Okay, great, thank you. So I think I've gone through sort of my questions and most of the questions coming on. So I don't know if anybody wants to, if they did have other questions that they want to drop those into the chat. I guess, Andrew, if there's anything else you wanted to sort of like tell us about or that we haven't covered so far, yeah, it'd be useful now, be a good time for that.
Well, I think one of the questions I'm really asked is exactly why am I doing this? And I think people should know. I think it's partly because I think it needs to be done. I think it's immoral that people are currently unnecessarily exposed, and mesothelioma is entirely avoidable. Entirely avoidable. If you don't inhale asbestos fibers, you will not get mesothelioma. But also partly is because I think it's something that can be done. It only needs maybe less than 100 investors. It only needs maybe 1,000 or 2,000 people out there, the right people to actually engage. And that to me is quite important because I don't know about other people. I quite like the underdog. Asbestos has been ignored for too long. But I also, it's nice to feel that one can take one's own skills or work with people and get something done. The current world of, it's all a bit intimidating. The current climate change, it's just nice to think, well, a little bit here, and we might actually get something done that's really important. And that's really what's given me the motivation to keep me occupied for the next few years.
Yeah, no, that's great. No, and that is something that we really sort of get at Ethex. If you look at the types of organisations that we bring on, they are, very often doing what bit they can in the areas that they can affect to try and deal with issues such as climate change or inequality or just making communities more resilient. And that's what our investors want to do as well, and it's the way that they can do that. They can use their money in such a way as to have that positive impact.
Yeah, and I've loved the fact, looking at the range of the investors, I've loved the fact that we've got people putting in £500 on the one hand and tens of thousands of pounds on the other and stuff in between. And I think it's a great platform that you guys have, and appreciate being on there.
Yeah, no, thank you very much. Well, I mean, I think I'm conscious of time, and we're sort of at a point to wrap it up there. As I say, really informative session. I think I just love the way you've got just a really neat way of dealing with a problem that needs dealing with, and it's straightforward, it's affordable. As I say, it's a bit of a no-brainer, really. So great you're doing that. As I say, the offer is live on the Ethex platform at the moment. They've only been open for a few weeks. You're already at 2 weeks, couple of weeks. Yeah, you're already at 75%. So I say to people, if you're interested in learning more about it, then go to the Ethex website, have a read through of our profile, download the offer document, have a read through there. But yeah, I'd just like to finish up saying thank you very much for your time today, Andrew. It's been really informative.
And thank you, and thank everybody out there. I can't see you all, but thank you everybody out there for taking the interest. I really do appreciate it.
Yeah, no, that's great, and thank you for for the audience being really engaged and sending through the questions. But okay, well, thank you very much, Andrew. Thank you very much to the audience, and hopefully pick up another Cuppa Club soon with everyone. All right.
Thank you. Bye bye.
Bye now.